I'm Sofia Mendes. I'm a compliance consultant and I work at Buxton Coates Solicitors. This video will go through the top compliance questions dental practice owners ask us. How do I know if my practice is actually CQC compliant? Well, this is probably the most common question we're asked. The short answer is that compliance isn't just about having documents. It's about being able to evidence that those documents are used in practice. If your policies are up to date, your audits and risk assessments are completed with action plans, and your team understands what they do and why they do it, you're usually in a strong position. If you're relying on paperwork alone, that's where issues tend to arise. Question 2. How often should we review policies, audits and risk assessments? As a general rule, policies should be reviewed at least annually or sooner if the guidance changes. Audits and risk assessments should follow a clear schedule with outcomes reviewed and actions documented. One of the biggest gaps we see is where reviews are done but there's no evidence of follow-up or improvement. CQC want to see that you're learning and acting, not just filling documents away. Question 3. What does CQC focus on most during an inspection? Well, CQC are going to look whether what's written down matches what's happening in reality. They review governance documents, but they also spend time talking to staff and patients, observing workflows, and walking around the practice. Infection prevention, safeguarding, consent, and team culture consistently feature heavily, alongside maintenance records and risk management. Question 4. Do staff really need to understand compliance, or is it enough for management to know? Well, staff understanding is absolutely critical. CQC don't expect every team member to quote regulations, but they do expect them to understand basic processes. Things like what happens after a sharps injury, how consent work, or how decontamination is carried out. When staff feel informed and involved, inspections are noticeably smoother. Question 5. What's the biggest compliance mistakes you see practice make? One of the biggest mistakes is treating compliance as a once-a-year task or something to fix when an inspection is announced. Another common issue is missing action plans. Audits identify problems, but no one documents how they're being addressed. Compliance works best when it's built into day-to-day practice rather than treated as an extra job. Question 6. How can we make CQC inspection feel less stressful? The most effective way is preparation done early and consistently. Clear systems, organized documentation, regular team communication, and realistic training plans make a huge difference. When everyone knows what to expect, inspections feel far less intimidating and often much quicker. If compliance feels overwhelming, you're not alone. Most practices don't struggle because they don't care. They struggle because they're busy. The key is structure, consistency, and involving the whole team. Thank you.